In September 2012, members of our family, Jay, Emily, Jim, and myself, attended and participated in a continuing medical education conference in Kumasi, Ghana. Ghana is located in West Africa and is surrounded by Ivory Coast, Burkina Faso, and Togo. The conference organizers were Tricia, Noreen, and Doctors Jay and Jim Homme. There were about 20 medical professionals, mostly from Rochester, Minnesota, that participated. After landing in the capital city of Accra, the next day we went by bus to Kumasi, which is in the upper left, and then returned by way of Cape Coast and the lower center on our way back. While in Accra, we stayed at the very nice Golden Tulip Hotel, and the next day we packed all 20 of us in a bus and headed for Kumasi on a road that was sometimes paved and sometimes not so good. At a rest stop on the 7-hour journey to Kumasi, we stopped at a pay restroom. The going rate was 50 cedis, or about 25%. We also spotted there this fine-looking colored gecko, and Jim was looking at a roadside stand. It was after dark when we arrived at Kumasi. We stayed again at the Golden Tulip Hotel there, which was very nice as well. We saw many street vendors in Ghana, mostly carrying food items, some water, and some clothing or some cloth, and that usually was displayed on their head. Many of the street vendors, here we have bread and peanuts, and look at the size of those carrots. Aren't they something? This is a very common scene in Ghana where mothers transport their infants wrapped in cloth at their backs, and the infants seem to be very content. Ghanaians have a good sense of style, as this woman displays. What a beautiful dress. In Kumasi, we went on a side trip to the cultural center. On the way, we saw a pickup with a Minnesota license plate. When we got there, there was a basketball tree and a man casting bronze using the lost wax method. The conference itself was held in the Cath Regional Hospital. Here we see a conference room and Dr. Jim Homme opening the conference. Here are some of the conference workshop topics. One topic that was of particular interest to the medical professionals on the opening day was a talk on suicide risk and prevention. Until about 6 months ago, attempted suicide was viewed as a crime, and then the law changed, so now those who attempt suicide are referred to mental health professionals. In the upper left, Dr. Jay Homme did a workshop on helping newborn babies breathe. Upper right, Noreen filmed some of the workshops. Lower left, Dr. Eric Madison is doing a muscle-skeletal exam, and then the lower right. In the lower right, this curious young man showed up at one of the workshops, and we took a picture together. In the upper left is child life specialist Sarah Huskus, who did a very interesting workshop in assisting children who are having procedures or have injuries cope with their stay. In upper left and lower right, Doctors Homme are working on various aspects of helping babies breathe. And in the lower right, Dr. Ronna Campbell instructs medical professionals in the techniques of adult life support. In the lower left, ultrasound technician Noreen Johnson examines a woman who is 24 weeks pregnant and informs her that her baby is a girl, to add to the 2 she has already, and she won't be getting the boy that she wished for. And Dr. Jay Homme is not showing off his legs, but showing the proper location for an injection on a baby. The conference ended on Thursday, and on Friday we boarded the bus again to go to the Cape Coast area of Ghana. While some of us were leaving by bus, Dr. J. Homme and his daughter Emily flew back to Accra to meet with a girl that they were sponsoring, whose name was Mercy. They went to a mall and had some pizza and had generally a very positive interaction. Here are a few photos of our trip to the Cape Coast. On the upper left, you see latex foam, your partner for life. This was advertised all over the place. The lower right, we have some some more photos. In the upper left is an unfinished building, very common in Ghana, as construction is a cash business and with very few loans. So people build what they can, and when they run out of cash, they wait till they get some more. The road to Cape Coast was America financed and built, so it was a much better road than what we had seen previously. All along the way, we saw various markets and items for sale along the road. There was a few goats and lots of people selling various things. Just before Cape Coast, we stopped in a rainforest and hiked up the mountain to do a canopy walk. If you see the bridge in the lower right, was made of ladders and of planks. There were about 8 bridges between trees, and they varied in height of 18 to 40 meters above the ground. About halfway out, it started to rain and got steady. I guess that's why they call it the rainforest. On the way back down the mountain, we saw this very large bamboo tree and a snail that was either very large or a hand that was very small. The next stop was a slave castle and on the ocean where many slaves were transported in the 16th and 17th centuries. And in the lower right is the door of no return, where slaves would go through on their way to a ship. A very moving experience to see it. On Friday night, we stayed at the Coconut Grove Beach Resort, a place on the ocean that looked like it could have been in Tahiti. It was a very beautiful place, had good food, a golf course with some horses on it, and on the way there we saw a fish market and all of these large containers full of small fish. On Saturday, we went from Cape Coast to Accra. In the upper left, you see Tricia, Noreen making some of the best peanut butter sandwiches one could hope to eat. There were various stands along the road with admonitions such as believe in God or patience, and there was even a roadside casket stand. In Accra, we stopped at a couple of markets. One was a upscale shop called the Wild Gecko, and there we saw the rare Kawasaki and rare Honda birds outside. This scary fellow was in another market where we bought a lot of souvenirs and did some bargaining, which was a very interesting experience. Kathy Tilbury, shown here with one of the 3 young men she supports in Ghana with education and housing help, demonstrates how helping an individual can lift them out of poverty and give them skills that will benefit them throughout their life. Tom Peterson, a businessman from Topeka, Kansas, who is also on the Africa Partners Board of Directors, is working at a more strategic level to bring primary medical care to the country of Ghana. Tom and his group are proposing a program called Primary Mobile Med, which will bring primary care to the countryside of Ghana. They propose to use a 40-foot shipping container that opens on the side that's been outfitted with a primary medical clinic on the inside. Several of these would be distributed to villages in an area and would be staffed by a nurse who could do primary care, and if she ran into something more complicated, would do a workup and send the information to a doctor who is connected by smartphone. The doctor could then make diagnosis and prescribe special treatment or transport for treatment somewhere else. On Saturday evening at 10 o'clock, we boarded a plane for Amsterdam, and after a layover there, flew into Minneapolis and then on to Rochester. Total time in the air about 22 hours, and there was a little bit of jet lag. On reflection, it was a very good experience where I met some very nice people on the team and in country, and enjoyed the culture and the experience and helping with the conference.